So, are you community pharmacists looking to get out pharmacy? So, chances are you're probably watching this video because you're like, hell, what is pharmacy consulting? In today's video, I take a quick segment of our full podcast and kind of interview Blair from Pharmapreneur Academy, where she teaches other pharmacists how to set up their own pharmacy consulting practice. It's very, very interesting, and it's really awesome that doing something like pharmacy consulting not only changes the way that other healthcare professionals look at us, but also it changes the way that people look at pharmacists from the patient's perspective too. We're more, at the end of the day, we all know that we're more than just people just counting pills behind the counter. We can do so much more, and we're so underutilized. Blair has a really great solution for that. So by the end of this video, if you do want to do something like pharmacy consulting and you do sign up for a program, use my affiliate link. It helps me out, helps you out, helps her out. It's a win-win-win for everyone. If you want to learn more about pharmacy consulting too, we have our whole full podcast as well, so check that out. Let's get to the content in 3, 2, 1, whoop! And we never really talked about what exactly is pharmacy consulting, right? Can you give us kind of like a breakdown, maybe like, just a overall breakdown of what pharmacy consulting is, and what does a typical day as a pharmacy consultant, what can it look like? I know it depends on a lot of different factors, but what can it look like?
So I use the word consultant to refer to offering one-on-one clinical services. Mm-hmm. So sometimes when people say consultant, they mean like in a long-term care setting, a licensed pharmacy consultant in long-term care. That's not necessarily what I mean. I mean, you can do that, but that's kind of a difficult market to break into if you don't have specific licensing. I know I'm in the state of Arkansas, you have to have a license for consulting to be able to work in long-term care. So that's not necessarily what I'm talking about. What I'm talking about as a consultant is leveraging your clinical skills to create a program where you're working directly with patients. So it could be doing an MTM program where you're offering comprehensive medication reviews on behalf of a pharmacy owner that doesn't have time to do them themselves. Mm-hmm. Or you could be running a tobacco cessation program or diabetic education or a vaccine clinic, or you could be going into a physician's office and working under a collaborative agreement with the physician to do annual wellness visits or chronic care management, where it could even mean, as like in the case of the functional medicine pharmacist, having a cash paying program that you work one-on-one with patients. You can collaborate with a synergistic business or have a standalone practice where you're doing weight management, or you're doing health and wellness consults, or you're doing genetic testing. So there's a lot of opportunities in consulting. And I think the goal with like the Elevate Pharmacy Virtual Summit was I just went out and found a lot of pharmacists that were doing innovative, cool things. And, imagine if you were like at a conference and you just sat through a 1-hour CE lecture and they presented their model and they talked about how they're impacting patients. Okay, now they're coming down off the stage to sit down and have a cup of coffee with you, and you can ask them questions for 20 minutes.
Yeah.
That's exactly like what the virtual summit really is.
Yeah.
And I identified these pharmacists in like cool, innovative models so that I could share their stories and their experiences. And that was really the goal with the Elevate Summit, is to show these clinical services that you can offer in addition to, or, alongside other collaborative providers.
Love it. And I know great job with the virtual summit, by the way, and kind of coordinating that. But I know there's some pharmacists kind of sitting here and thinking like, hey, why would anyone want to hire me for pharmacy consulting, right? Sometimes when we ask those type of questions, we get so caught up in our own heads. But
what kind of impact, I guess, if we were to go down, if pharmacists were to go down pharmacy consulting, what kind of impact do they have on the healthcare system and actually on the practices? Like, I know there's a lot of different opportunities, but what impact could we potentially have for these practices and impact on healthcare?
This is a great question. So I mentioned value-based care.
Yeah.
So, it's kind of a buzzword right now. What essentially it means was there was legislation passed in the MACRA Act. It was the Medicare Reauthorization Act or something like that. And so essentially what the MACRA legislation did was create these two different routes of reimbursement. So the primary care clinic could choose to be a MIPS clinic and choose a certain set of quality metrics to be graded on, or they could choose the advanced payment model, which is more similar to like a per member per month flat fee.
Mm-hmm.
So MIPS is more like traditional Medicare, just reimbursement, fee for reimbursement.
Yeah.
But they're choosing these quality metrics to be graded on. So one thing I coach Academy members to do is we talk about the different quality metrics that pharmacists can impact. So for example, getting an A1C below 7%.
Yeah.
That's one of the quality metrics that many primary care physicians may choose. So you go in, and I kind of already mentioned the pitch where it's like helping reduce burnout. But if you identify their pain point is being hit with all these penalties because they're not meeting these quality metrics, you can kind of shift your pitch to, okay, I'm going to focus on your diabetic patients, the ones whose A1C is always above 7. They say they're taking their medication the way they're supposed to. They say they're using their insulin every day. They say they're not eating carbs. Like, these are the people that I want to come into your practice and help. Yeah. So as we do that, we learn that they can't draw up their insulin correctly because they can't see well enough on the vial, and so they just don't take it, or it makes them squeamish or whatever it may be. So having an impact on these quality metrics can translate into hundreds of thousands of dollars, like in decreased reimbursement, in penalties, in incentive payments if they do meet their benchmarks. And then it also reduces readmission. So a lot of the return on investment for pharmacist services, the studies that have been done, the journal articles, I've got probably 5 journal articles right here that I've been needing to go through that talk about pharmacists embedded in primary care and what the return on investment looks like. So reduce readmission rate, keeping people out of the ER, keeping people on, from advancing COPD or CHF, just better management of these very complex chronic conditions that they need to have someone on their team that gives them more touch points. So it may look like going in as a pharmacist and doing chronic care management. Chronic care management is using the CPT billing code 99490 to bill for a once a month, non-face-to-face, 20-minute patient touch point. So it really makes a lot of sense for a pharmacist to do this. And what we're seeing now is even community pharmacies partnering with local physicians' offices to kind of pick up the slack whenever it comes to like, hey, we're talking to them once a month anyway about their refills and their adherence issues. So why not have a partnership to where you can be reimbursed for those services and the physician's billing for them, and you're working together to offer this better patient care?
Wow, that's a huge win-win situation, win-win outcome for both not only the practice and the pharmacist as well. So it sounds like you mentioned a few things. Obviously, there's the financial incentive, like to have a uh, pharmacy consultant on board because there's increased reimbursement. You talked a little bit about increased quality of care as well. We talked about decreased hospital admissions, but even from a more macro sense, like the truth is, there's a lot of primary care physicians out there. There's a lot of different, uh, yeah, practitioners out there. At the end of the day, what differentiates this one from this one, right? But when you have such an intimate level, it sounds like, well, correct me if I'm wrong, but it sounds like it's pretty high. You said high touch point, right? So there's probably a lot more interaction. That's really what keeps people with you and whatnot as well. And from a brand, from a marketing perspective, from a brand and positioning, man, that's a really great unique selling proposition for most people. Love it.
I think it's going to allow physicians to see more complex patients
Yeah.
and see more patients and have someone that they feel is providing that kind of like different view. So one of the Elevate Summit interviews that I just recently did was with a pharmacist physician collaborative team.
Yeah.
So there were three of us on the call. So, I said, Dr. Pettis, you've been working with a pharmacist for, 9 months now. What would you say to the pharmacist or physician out there that says, why would I hire a pharmacist? They're too expensive. Why wouldn't I just hire an MA instead?
Yeah.
And his response is like, I want someone who is trained differently than me. He was like, PAs and APNs, they're trained in the same way that I am, but a pharmacist is trained in a completely different way. They're looking at it from a different lens. They've kind of got their pharmacist glasses on and they're saying, could this symptom be medication related? Is there a better way to optimize this person's therapy? And he's like, this, I think in the future is going to be much more commonplace. And the title of that interview was like reimagining primary care. So
Yeah.
I have this vision of pharmacists being able to work in physicians' offices and it being as commonplace as having a PA or an APN in the practice.
Mm.
So I think that can help, alleviate the job shortage.
Yeah.
Or job saturation. I think it can help with burnout. And I think it can really, my ultimate goal and the tagline, it's not just a tagline for the Academy, is advancing the profession of pharmacy. And I feel like we can do that by working in these innovative type models.
Mm. I love that. Actually, as you're talking, I actually was taking like some notes so I wouldn't forget some of the thoughts. But one of the things that I wrote down was like, dude, you're really changing I guess the branding or how people perceive pharmacists and really expanding the scope of practice of pharmacists. Because when you go to anyone out on the street, you ask them, what does a pharmacist do? Their vision of a pharmacist is that 1950s pharmacist, just counting pills and that's it. But really, I love this because you're not only like you're really impacting and changing the perception of pharmacists even within the healthcare system, because even a lot of healthcare professionals don't really know what we do, right?
Yeah.
So
Yeah,
I love that. That's awesome.
I think, one thing too is like, I love what you said about kind of rebranding ourselves.
Yeah.
And one thing I hear from physicians is like, where do I find pharmacists that can do this? Where do I find pharmacists that can help me with this?
Yeah.
And that's where I'm like, okay, maybe we need like a match.com for physicians who want embedded clinical pharmacists. And you just come through the academy, I'll match you up with a local physician and it'll match made in heaven.
Oh, that's so funny. That's awesome. Like, because you know what, when I first took a look at your pharmapreneur type of thing, I didn't really see that vision, but actually hearing you talk about it, I really see the clearer picture. And I think it's actually a really, really great model for a lot of pharmacists because not everyone wants to like do a different business model. Like for me, I like to introduce people to different business models like, hey, Amazon FBA or other things. But this is a great way where you can use your high income skill and apply it directly to a business model. And just kind of curious, what are the initial, like, are there initial startup costs uh, with this sort of business model for the most part?
So I usually recommend that people go ahead and do an LLC.
Mhm.
You could do a sole proprietorship with it, but I think the LLC just gives you an extra layer of liability.
Yeah.
You can actually get liability insurance on the LLC.
Mhm.
So like professional healthcare liability insurance on the LLC.
Yeah.
So that's really like kind of our foundation of the academy, is like figuring out what pieces do you need to have in place so that you can confidently build a business on top of it.
Mm.
So the LLC is always something that I recommend. And then just as far as marketing, I am a big proponent of like minimum viable product.
MVP.
So MVP, don't go waste your money on building out a website when you don't even know what your pricing or your product or any of that stuff is. Like I was talking to someone this morning
Yeah.
and I said, first thing that people do when they start a business is go get a business card. And I did the same thing. So I mean, I'm guilty. So
Yeah.
I just got this is my second business card thing ever. And it's been 4 years. And
Yeah.
I just bought a new stack of them because nobody wants your business cards. So what what they want is you to go out and have conversations with them and talk about how you can help them. That's what they really want to hear. So that doesn't cost much either. So just kind of putting together a few basic things and basic ideas. There's lots of free resources on my website that's just kind
Yeah.
of get you started on thinking about here's the different opportunities that you could possibly look into.
Yeah, I love that because it's really funny. In high school, I started this protein company and whatnot. And the first thing that we did, we bought business cards, right? I
Right.
still have that same stack back in high school to this day. And
Yeah.
I think it really goes back to what you're saying, like focus on the problem, be problem and result oriented, and talk to other people, see what kind of problems they're going through, and just really kind of see if you can help. And I think like if there's one common theme throughout your whole story is that this whole time you've just been solving problems, whether it was like, um, working at independent pharmacy and they needed help with their MTM claims. And then people were asking you like, hey, how do I open up my pharmacy consulting practice, right? You are just constantly solving problems and you're currently solving a huge problem uh, in pharmacy right now with our branding and all that. I love it. I think this is like a burning question a lot of listeners are probably thinking about. But what is kind of like, I know everybody's timeline is very different, but I guess like from start to finish, how long, people are going to ask, how long does it take? Or what are the kind of like the steps from start to finish, I guess, right? If they were to go into Pharmapreneur Academy.
So that's a good question. I'm trying to rework the course so we have more of like a success pathway kind of thing.
Sure.
So 1 to 3 months out, the goals are registering your LLC, identifying your target market, reaching out to potential leads, and having your first meetings, your first face-to-face meetings. Hopefully by the end of the 3 months, you're going to get some real interest in these services. The first meetings are like going in there I'm creating like an assessment questionnaire of like what say if you're going into physician's office what their needs are, what their pain points are, and using this kind of assessment questionnaire to determine, which services or programs could you build out for them. And then the next 3 to 6 months is kind of putting a proposal together, figuring out like the beta test for it. And then 6 to 8 months is scaling. It's once you've kind of worked through those beta test patients and kind of validated the idea, 6 to 8 months is when you're like, okay, let's fill up this schedule. Let's really start looking into return on investment and tracking these interventions. So whenever I say between 6 to 8 months to build a business, I'm like, you're not sitting on your computer watching my course videos for 6 to 8 months. You are, watching your foundational videos and then doing your homework and taking your action steps. And so there really is a pathway. That being said, some pharmacists come in and after 1 month, they're like, yeah, physicians said that they wanted to hire me 1 day a week and they think it's going to grow into a full-time position. And I'm like, well, that's great. So, it can happen faster, but I would say for most people, just keep in mind that there's, it's something new. You're kind of having to educate the market alongside of creating the product.
Because at the end of the day, I always like to say this because I've bought so many programs myself, right? It's not on the course, man, because the truth is, if you binge watch like Netflix and do absolutely nothing, your business is not going to just appear like that, right? And so it's really like, I love that rough roadmap, but what you're really trying to teach people is how to set up your own true business, like your true pharmacy consulting practice. People, like, it's not just how to get a one-time gig. It's really how to create a sustainable business which you can scale and grow. And I love that vision. I guess like some of your most successful students, like, do they end up being like 6-figure, 7-figure type of business? What's the range? I obviously there's pretty much no cap, assuming that you get more clients, right? But what is the typical, I guess, range of how much can you make? Can you like really replace your full-time income if you're a community pharmacist doing this, right?
Right. So it kind of depends on what you're doing. So I usually say if you work for, say, between 8 and 10 community pharmacies, just doing an MTM program, that would be like replacing your full-time salary. So I talk about working on retainer. I talk about, what to charge for your services, how to organize and track and invoice and all the business stuff. There is no clinical skills taught whatsoever in my course. I want to stress that. I'm a business person. And so, with a community pharmacy based business, you're talking consulting for maybe 8 to 10 different pharmacies doing different services. For a physician's office, depending on how many Medicare patients they're seeing, 3 to 4 physicians would probably cover a full-time pharmacist. Now, I've got pharmacists in the academy who are building businesses. They're like working in physicians' offices and then hiring other pharmacists to work under them and then placing them in these settings as well. So that model would definitely be scalable, but we see, a single pharmacist max out pretty quickly in their patient load, but you can replace a pharmacist's income. It's not going to happen overnight like that, but it is something that, you get 3 or 4 physicians you're working with, you're going to have a full-time patient load. Versus now you can start, hiring pharmacists and interns and that kind of thing to work under you. And then placing them in the clinics. And then that's a scalable model.
Yeah, that's a classic, very, very classic consulting model. One of my partners, he was at the Big Four, and he was like, I remember the day he was trying to teach me this. I was like, wow, that's really smart. So you basically that's really great. If you're a good engagement partner or a good client partner, you can actually help other pharmacists kind of find gigs and connect them there. And that's definitely a scalable business. Well, I guess like if people want to kind of learn more about pharmacy consulting, where can they really find you?
So my blog and all the new posts and new information that I put out is on my main website, which is btpharmacyconsulting.com.
Mhm.
And that's where like our free webinars you can find. You can go on there, watch them to learn kind of the basics of pharmacy consulting. I've got a few more advanced webinars on like the macro legislation and quality metrics that are lots of good fun. And then there's of course free downloads that people can use to like streamline their elevator pitch or their star ratings and track those. So there's lots of free resources on that site. The paid course and membership site is pharmapreneur and that's where people can come in. They can go through my signature course teaching them how to build a pharmacy consulting business step by step from start to finish.
Yeah.
And the good thing about that membership is that they get access to me in that course. So there's a forum and a community in there of people that have gone through the course. They answer each other's questions. They understand what we're working towards. And we share like a similar language around consulting.
Yeah.
And once a month, we all jump on a big Zoom
Zoom
call,
call. Yeah.
just like this, and we talk about what we're working on, what our goals are for the next month, and we try to hold each other accountable and give each other that support that like I didn't have when I started my business.
Yeah. Love it. Love it. Love it. Well, hey, I loved having you on this podcast. I think I learned a lot about this. I definitely know my other viewers, man. There's so many people that want an alternative career. And I think this is based off what you talked about. Like, dude, this is up right along. This is up along a lot of people, a lot of pharmacists' alley. And I think they're going to do really, really great because you don't have to learn a new skill. You already have the skill, right? Now you just need to learn the business acumen and whatnot. So
Yeah, that's what I say, to people who are like, I hate pharmacy. I just want to get out. I would do any other job. I just want to start a business. And I'm like, well, why don't you start a business, but using your pharmacy skills instead of going and learning the real estate market, like just use the skills you already have and see where that takes you. You never know where these opportunities might lead.
yeah, and best part, no inventory, relatively low startup costs, and you already have the skills. So it sounds like a perfect fit for a lot of people.